First, let me explain that we have come here with our mask on, but we have decided to remove the mask during the conference so that we are able to speak clearly and you'll be able to hear us clearer. There have been some comments that we have reduced the testing of migrant workers, leading to a drop in the number of COVID-19 confirmed cases. Let me say that this is not true. Our testing capacity for migrant workers is about 3,000 a day. We have not reduced it. Instead, we have been increasing the capacity of testing of our migrant workers. The rate of testing has not slowed down. A total of 21,000 migrant workers living in dormitories have been tested since the start of the outbreak. This means that 1 in 15 migrant workers in dormitories have been tested. This is far higher than the testing rates seen in other countries like Korea, which is 1 in 90, as well as other countries like US, UK, or even Hong Kong. Let me also put in context, testing serves 3 very important objectives. First, for us to diagnose patients so that we can provide them with appropriate treatment and care. Secondly, for us to carry out contact tracing so that we can limit and control the spread. And third, through testing, we carry out surveillance to allow us to focus on high-risk groups and targeted groups, which I'll explain later. We have started our testing with the dormitories where there were a high number of cases detected, and now we are actively testing the other dormitories as cases emerge, including the factory-converted dormitories. With this testing approach to determine the extent of infection in the dormitories, the case count from the dormitories will depend to a large extent whether there is a high prevalence rate in these dormitories. But every positive test is added to our daily count. Some of the migrant workers continue to work as they are essential workers. Therefore, to reduce the risk of transmission in workplaces and the wider community, we have also prioritized the testing of migrant workers in essential services during this period. We are also actively testing around confirmed cases in these dormitories where new cases are starting to emerge in an effort to isolate cases and contain further transmission to prevent these dormitories to have many clusters evolving. For dormitories where the assessed rate of infection is extremely high, our efforts are focused on isolating those who are symptomatic, even without a confirmed COVID-19 test. This allows us to quickly provide medical care to these patients. At the national level, we have also been steadily building our capacity to conduct tests for COVID-19 over the past few months. Compared to conducting an average of 2,900 cases a test previously, we are now able to conduct more than 8,000 tests per day, and we will continue to expand our capacity. Today, we have already put in place targeted testing for selected groups, for instance, to ensure the essential workers move out of dormitories are free from infection, or for staff of institutions such as nursing homes, where there is close contact with our seniors. We intend to gradually expand testing to a wider pool of essential workers in order to further the continuity of to ensure the continuity of critical functions and services. This is also important as we start to open up after the circuit breaker measures. Testing remains a key prong of our strategy in this war against COVID-19. But what is more important than testing is for everyone to play our part to prevent transmission by observing circuit breaker rules and guidelines. So on this note, I will now ask my colleague, Minister Lawrence Wong, to say a few words.
Thank you. Good evening. You've heard from Minister Gan earlier about the important role that testing plays in diagnosis, in active case finding and surveillance. I'll just touch a little bit on the part that we are doing with regard to monitoring and protecting our essential workforce. We are starting to test more regularly workers in the essential sectors, particularly those in vulnerable or working in vulnerable areas. For example, the staff in our nursing homes, as well as our healthcare workers and frontline officers who come into close contact with confirmed cases. So we want to do this to ensure the well-being of our essential workforce and also to protect seniors and vulnerable members of the public. Each time we do these tests, it will help us to detect early and also to prevent any clusters from forming through these early detection. And as Minister Gan said just now, this aspect of testing is critical, particularly as we plan for a phase beyond the circuit breaker. Eventually, we will want to gradually relax our restrictions as our community cases come down and resume activities. This needs to be done in a safe manner without us risking new infection clusters from forming. All countries are grappling with this as they move out of their lockdowns, relax measures, how to go about doing this in a safe manner. And the key enabler for this is really to have a scaled up testing capacity. And that's why we are ramping up, scaling up our testing capacity, not just doing this with existing PCR tests, but also looking at new technologies that might be available, including potentially point-of-care test kits that can be scaled up more rapidly. This capability to ramp up, to build up more testing capacity is critical as we seek eventually to resume and restart our economy. But an important point to note is that testing, while as critical and important as it is, cannot be a substitute for personal responsibility and safe distancing measures. So we go back to the fundamentals and ask everyone during this period to stay home, uphold good personal hygiene, and for those who are in the essential workforce, even as we start to test more of these people who are working, anyone who is now in the essential workforce should still continue to take precautions, meaning to say, as they go to work, minimize contact with their colleagues. Don't go to work and then end up socializing during lunch break or during break times at the pantry or outside the workplace. Right? Minimize all contact, go to work, go back home, and if you're not feeling well, it's critical, don't go to work, right? Ensure that you do not have symptoms or even mild symptoms and then go to work, end up transmitting potential infection to your colleagues. These are reminders that we have been telling everyone, and it's very important that we all continue to uphold these very basic precautions and safeguards together with a ramped up testing regime. So testing cannot substitute for all of these. Remember, even when you test, it will not be 100%. There is a chance that you can test negative, but you are in the incubation phase. And so that test will not pick up the virus during that phase. So all of these things have to be done as part of a holistic strategy in order for us to suppress, slow down the spread of the virus and ultimately defeat COVID-19. Thank you.
Thank you. I'll now ask DMS Professor Kenneth Mak to give an update on the cases.
Thank you very much, Minister. The press statement for today will come out a little later this evening. We are reporting an additional 799 new cases today, of which 14 of these cases arose in Singapore citizens or permanent residents, and the majority of the other cases arose in foreign workers who are living in dormitories. More information will come out in the press statement later. Of the foreign workers that we have in the dormitories, and none of them are in the ICU at this point in time.
Okay, now I'll open the floor to questions.
Thank you, panelists. We will now begin with the Q&A. Media agencies, please remember to use the raise hand function if you would like to ask questions. Please remember to stick to one question only. May we have the first question from Nabila from Today? Nabila?
Hi, Nabila here from Today. Can I just find out how many foreign workers actually live outside the dorms and they are housed in like what types of accommodation? Like, can we get a ballpark figure of the percentage of those who, how many workers that live in maybe like, you know, not in dorms, like basically out of the dorms?
Yeah, the figures are in our, I think if you look at the MOH statement every day, then there is an annex that's on the website. In fact, those figures are all there because we break down our data by community, and then we look at work permit holders, migrant workers, in dorm and outside dorm. I don't have it offhand, but it's there. And then outside dorm, of course, they will live in a range of different housing types, including HDB, private residential, and so on. Right? So if you look at the annex to the daily MOH statement, those figures are all published and updated every day.
Next question.
The next question will be from Salma from ST.
Thank you.
Salma, please.
Your dorm numbers are very high, but you seem to have a very good handle on that. I'm more concerned about the community cases, and I'm wondering why MOH divides the community cases into Singaporeans, PRs, and pass holders, and then foreign workers outside of dormitories. As Minister Wong just said, these people live in HDB flats or shop houses and also include your foreign domestic workers. So they should be part of the community. Do you separate them because they may more likely get infected by dormitory workers, for example, through socializing? Is that why?
The main reason, Salma, is that if you look at the infection amongst work permit holders, there is a large concentration of them linked to construction, right? So for construction, we have a separate strategy, and that's why we have put the construction migrant workers on stay-home requirements. A large number of them are in the dorms, but to the extent that they are staying outside of the dorms, there is a separate strategy to deal with that, right? Focused on these group of migrant workers. And that's why we look at that, at this particular group separately, because large numbers of them are essentially construction workers.
Perhaps I can add on to explain that it is very important for us to have a more detailed breakdown of the different cases so that we can better understand the way the virus transmits, the epidemiology behind it. For example, some of the foreign workers who are even living in the community, they may not have family members, so their infection could be primarily from workplaces or in the community, in the social setting. And we also want to monitor whether they are transmitting among the foreign workers community, whether they were because they are more closely related to construction or any other particular sector. So, but the breaking down of these different groups allow us to have a closer monitoring of how the disease is progressing in the community. For the SC and PRs, citizens and permanent residents, for example, many of them would have family members in Singapore, and therefore it's also important for us to monitor them quite separately to see whether there is transmission within the households. So I think we broadly classify them as community, but within the community, we do break down between SCPRs and the different community groups to facilitate our tracking and monitoring of the disease pattern. And hopefully that will also enhance our contact tracing and ability to stop the transmission.
Thank you, panelists. Our next question will be from Kai Yi from Channel 8.
I would like to ask the ability of testing on migrant workers. What is the average number of days from onset of symptoms to isolation facility currently for the migrant workers?
I'll ask the DMS to comment on that.
I don't have a specific number to give you at this point in time, but I will say that the number will not be very long, simply because if we're talking about foreign workers living in the dormitories, on a daily basis, we invite all who present, all who have symptoms to come down to the medical team that's stationed supporting the dormitory. And the medical team is quite aggressive about trying to broadcast and invite them to come down. So if the foreign workers have symptoms, they would in fact then come down, and immediately when they come down and they're found to have symptoms, then they are effectively isolated from that point on. So the duration should not be very long.
Maybe I should also clarify that in certain dormitories, we do active, proactive case finding, which means we do quite aggressive contact tracing. So therefore, some of the cases, even before they have a significant symptoms, we have identified them and we have tested them, and therefore the time period between symptoms and diagnosis is significantly shorter within the dormitories because they are a well-defined group, and we have proactive measures in the dormitory to address their medical needs.
Thank you, panelists. Our next question will be from Irvina from Berita Harian. Irvina, please.
Hi, I just want to ask on the ruling on the home-based businesses during the circuit breaker period. So I understand they cannot operate with third-party delivery services, but does this also apply if they can ensure to practice contactless? That means seller place item outside house, then delivery person collect and send to buyer contactless manner also.
We have explained why we had to tighten up the rules during this period, all the way till 4th of May, why it is necessary and why these are requirements that all of us have to cooperate and work together on. Right? There will be some sacrifice, it's not easy, but we really call on everyone to hunker down during this final stretch, at least till 4th of May, because we do want to bring the community numbers down decisively. I think in recent days, you have seen some continued decline and moderation in the local transmission numbers, but we do want to go all out to bring those numbers down. So the current rules do not allow for home-based F&B. We have made that very clear. But if and when the community numbers do continue to come down, as we said, we are going to review the measures, and we may, if the numbers have been brought down, we may very well relax some of the restrictions, ease up on some of these restrictions, and at that time, we will let Singaporeans know when this or any other activity that we think would be that we think can start will be able to start resuming. Right. So at this stage, I think the rules are clear. We understand that there are groups who are impacted. They would like to do something. We ask for their patience. We ask for everyone's cooperation as we all work together to make the most of our circuit breaker period.
Thank you, Minister. Our next question will be from Gwyneth from CNA TV. Gwyneth,
Hi,
please.
okay. Right now, there's a lot of focus being placed on the migrant workers. What is your stance right now on how we're doing for community cases? And what is the long-term plan in terms of taking care, ensuring that clusters don't break out in community community cases as well. Is there going to be any regular testing for the community, the same way that is being performed in, for example, maybe performed for migrant workers?
So, what was the first part? Before you talked about long-term plan, you said what's our assessment of community cases?
Yes, what's the assessment now? Current assessment for community cases now? I mean, the implication is that when can we get our circuit breaker?
Okay, sure. We have said that we are trying to get our community cases down to single digit. It's not there yet, and not just single digit in one day, but consistently over a period of time. If we all do our part, I'm confident that we can achieve this because, as you can see from just the recent days, the circuit breaker measures are working, and there is always a lag effect, right? Because the measures are in place, and then you will only see the results 10, 14 days later. So we are already now seeing the impact of the circuit breaker. We just recently tightened up further, and that impact will only be seen 1-2 weeks later, right? So let's all focus on that, and I'm confident if we do our part, we will be able to bring the numbers down decisively to a single digit. As we said, when that happens, we will gradually start easing up on the measures and resuming more activities. You are absolutely right that as we go about this opening up of the economy, allowing more businesses to resume, to continue operations, more people to start commuting to work daily, there will certainly be a risk that new infections may come back. And that's why this has to be done carefully in a very calibrated manner, and we will need new enablers for us to go about this resumption of economic activities. Scaled up testing will be one major enabler, and second, technology, where we can do more to identify, track people's movements. Particularly if a case were to emerge, then we will be able to quickly move in to do contact tracing and ring fencing of the close contacts. So testing and technology are two key enablers. We are developing plans around both of these areas, and we will be able to share more details when we are ready. But these are critical enablers for us to progressively open up the economy.
I think it's important to bear in mind that for as long as there are cases in Singapore, especially the unlinked cases, whether it's among the foreign workers or it's in the community, it's important to understand that those unlinked cases means that there are cases, there are underlying transmission in the community that have not been detected. Because these cases have to come from someone, and that someone has not been identified. And therefore, we have to bear in mind that there will always be transmission that's ongoing in the community, and therefore we will need to do what we can to reduce the number of these unlinked cases in the community to as low as possible. While there may still be some risks, we need to manage that risk and reduce that risk to the extent possible before we are able to begin to open up and to remove the circuit breaker measures. Even as we remove the circuit breaker measures, we need to do it progressively so that we need to do so in a safe way to prevent the resurgence of new cases and new clusters, which will be another problem again. So it's important for us to put in place some of these additional measures that the Minister Wong has mentioned so that we are more ready to open up and to begin to roll back some of the circuit breaker measures when the time comes. So therefore, in the meantime, the team is working on planning on some of these measures and what are these the necessary enablers that we will need to put in place. And when we are ready, we will disclose and share with you more details when the time comes.
Thank you, panelists. Our next question is from Yang Ming from Taobao. Yang Ming, please.
Hey, Minister. Yeah, my question is still about the foreign workers. So currently, there are about 11,000 plus foreign workers living in the dormitories tested positive. Many of them are mild, and are starting to recover, will they be moved back to where they came from, i.e. the dormitories, or what is the plan to house them elsewhere in the meantime? Because we are not sure yet whether they'll get reinfected again. So are places like the Tanjung Bakar Port, as well as hostels at Anderson Serangoon Junior College, part of the plan to house these recovered foreign workers? Thanks.
Yes, we do have a plan to house the recovered foreign migrant workers. It's quite extensive, and it will involve new sites, new spaces that we will build. Some will be done sort of as short to medium term type housing arrangements, but then we are also going to start with longer term housing arrangements that we start now, and then eventually they'll be ready maybe in a year or two, right? So it's a whole pipeline of arrangements for the short, medium to long term, right? Thinking through holistically what's the ideal arrangement for housing of our migrant workers. So that's something we will present quite soon to the public as we pull together all of these plans.
Thank you, Minister. Our next question is from Vengadeshwaran from Tamil Murasu.
Hi, I'm Venga from Tamil Murasu. My question is, so currently the dormitories and purpose-built dormitories, the attention is quite kind of there already, but there are a lot of other migrant workers who are living outside of dormitories, like in shop houses or places where their employers have designated for them to live, like rental flats. So how these workers are primarily dependent on their employer to take care of them. So their daily meals, their salary has to be provided by the employer because they don't really have a dormitory operator to sort of take care of them. So how is sort of like the government or MOM in general making sure that employers take care of these workers? And I believe NGOs are also now trying to plug in those gaps. So how are they rallying those groups to make sure that workers outside of the dormitories are actually being taken care of?
So there are two groups that you speak of, because the migrant workers who are living outside of dormitories in private residential or shop houses, there's a large proportion of them who are in the construction sector who are on stay-home requirements, so they cannot leave. And for that group, the employer is indeed required to, attend to their daily needs, providing them with meals and all that. So we have a system between the Ministry of Manpower and the Ministry of National Development and BCA, because it involves the construction sector. We work with the employers, the industry association like SCAL, and we make sure that the employers follow up. And also, we do inspections on the ground to check on these workers that indeed they are taken care of by their employers. Beyond the group that is on stay-home requirements, the others who are living in shop houses or apartments or HDB flats, who are not on stay-home notice, they are not, they can leave, they can go out to buy essential items like any other Singaporean. So for that group, the circuit breaker measures will apply to them.
Thank you, panelists. We have time for one last question. Can we have Kayla from Mothership to ask a question? Kayla, please.
Thank you. We would like to know how much the ministry is looking to ramp up its testing capacity towards, and is there a timeline for this? Thanks.
We will want to ramp up as much as we can, as soon as we can. And so we are going all out, like I said, to procure more equipment, more test kits, looking at new technologies as well. So this is an all-out effort because, as I said, this is quite critical in enabling, it will be a critical component of our strategy beyond the circuit breaker. But I should also remind everyone that we have to look at this holistically. Testing is critical, it's very important, but it's one component of an overall strategy, and we should not just pin everything on testing and then assume that we can, after the circuit breaker is over, everything can restart, we can have all sorts of social interactions, F&B, dining, parties can go on. I don't think that will be the responsible thing to do. Right? Even after the circuit breaker period is over, all of us still ultimately need to exercise personal and social responsibility. We should still try very hard to minimize our social interactions, because it only takes one person interacting in a group in close quarters with many people to cause another cluster from happening. And while we can do more tests, and we want to do more regular tests, testing is never going to be 100%. Right? So it only takes that one person, that one missed test that may be infected to cause new clusters from happening. So as we plan for beyond circuit breaker, opening up, relaxation of some measures, opening up of some activities, let's still bear in mind the importance of all of us exercising individual responsibility when it comes to wearing of masks, safe distancing, good hand hygiene and personal hygiene. All of these things are still of utmost importance in order for us to be able to sustain this fight against the virus all the way through the end of the year and maybe even beyond the end of the year.
Thank you for coming to this press conference.